way, Mr. Frank. How are you feeling today?
Oh, same old, not too bad, not too bad.
Take a seat right here.
Oh, give me a sec for the old knees here. Oh, yeah. There we go.
Gonna do a quick review of your medical history here. Let's see.
Sounds dandy.
Looks like you marked that you have angina, is that right?
That is what I put there, yes.
All right, do you know if that's stable, unstable?
Yeah, you have to ask my wife Margaret about all that. She's out there in the foyer.
Okay, can you tell me a little bit about it? What typically brings on your episodes?
Well, when I get tense in the garage working on my Harley Davidson, that's, I feel like that can bring it on a bit there.
Okay, so
Yeah.
like anxiety, stress, exertion, things like that?
Stress, exertion, sounds about right.
Okay, so it sounds like you might have stable angina.
If that's what that is, then I suppose I do.
All right, and do you have a nitroglycerin prescription? Did you bring it with you today?
My wife Margaret, she's got that somewhere in her bag.
Okay, good to know. And when was your last episode?
I'd say around the 4th of July, flipping burgers, manning the barbecue. Yeah,
Okay.
around then.
Okay, so it's
More
been a
than
while.
60 days.
Okay, good to know. And typically, what happens when you're experiencing the pain?
I'd say it's something of a generalized chest discomfort where I feel a squeezing, a burning, a pressure can radiate through my arm, sometimes even up to the neck. And it is sometimes accompanied with a pallor or nausea.
Okay.
And I would say that the symptoms vary in severity and can last anywhere from 1 to 15 minutes approximately.
Okay, all right. Sounds good. And how are we feeling today? Are we anxious, nervous at all?
Between you and me, Olivia, I'm a little nervous.
A little nervous? All right. Well, I'm going to start with some vitals. But if anything starts feeling bad while we're in treatment, just let me know, okay?
Will do.
Angina pectoris is chest pain or discomfort caused by inadequate blood flow to the heart. Angina is usually caused by a buildup of plaque in the inner walls of arteries. This is usually called atherosclerosis. There are 3 forms of angina: stable, unstable, and variant. Stable angina responds to nitroglycerin, is usually induced by physical activity or stress. It can be worse in cold weather or after a large meal. Angina is considered stable if there has been no change in the last 60 days. Those with stable angina can receive dental care, however, appointments should be kept short and low stress.
All right, your vitals are looking great. Let's get started.
Oh, that's swelling dandy.
Just let me know if anything changes, okay?
Of course.
A few moments later.
Mr. Frank, you all right?
It's that tightness. It's the pressure.
All right. Michelle, you
Oh,
have a code blue going
nausea.
on. Do you need me to get you nitroglycerin?
The typical symptoms of stable angina are generalized chest discomfort, a pressure, burning, heaviness, or squeezing. This pressure may radiate to the left shoulder, arm, neck, or tongue. Pallor and nausea may occur. Symptoms may vary in intensity and will last from 1 to 15 minutes. An increased pulse and blood pressure occurs. Our patient is experiencing stable angina. However, if the patient is experiencing unstable angina, these symptoms will be the same, but intensity may be more acute, and it may last up to 30 minutes. If the patient is experiencing variant angina, they may experience the same symptoms, but also palpitation, syncope, and dyspnea. Variant angina may be more likely to occur at rest.
Okay, Olivia, do you need me to get you nitroglycerin?
Yes, please. He said his wife has it in her purse.
Okay.
Okay, sir, I'm just going to take your blood pressure really quick.
Okay.
Okay. Here is this.
Thank you so much.
You're welcome.
All right, there's your first dose of nitroglycerin. blood pressure are a little bit elevated.
At this point, all treatment should be stopped and the patient placed upright or semi-supine. The clinician should assess the patient's vitals and administer nitroglycerin. Oxygen can also be administered at 4 to 6 liters per minute. Nitroglycerin works by dilating coronary heart vessels, which decreases the workload being put on the heart. Nitroglycerin should not be used if the patient is hypotensive, as dilating the vessels may worsen hypertension. Using the patient's nitroglycerin is preferred, but dental office emergencies kits should contain it in case they do not have theirs on hand. Nitroglycerin should relieve inguinal pain for both stable and variant angina, but may not relieve for unstable angina. These patients are at high risk for MI and should receive only minimal or emergency dental treatment.
All right, it's been a couple minutes since your second dose. Are you feeling better?
I think we're getting there. Yeah, not quite hunky dory, but yeah.
Okay, the pain's gone away?
It's coming down, yes.
Perfect, your pulse is seeming a lot better. Do you feel okay to resume treatment, or do you want to go home for the day?
I think let's get this done. I've come all this way.
Okay, sounds good. All right, it's been a few minutes since your second dose. Are you feeling any better?
I can't say I am, Olivia. I haven't felt this bad since that tornado back in Wichita.
Okay, all right. I'm going to give you a third dose of this nitroglycerin. Michelle, will you call 911, please?
Yeah, I got you. I'll be right back.
All right, let's keep... Okay.
EMS is right outside and they're coming right in.
Okay, perfect.
It's important to note that if a patient has had no known anginal symptoms, that you should contact EMS immediately. Nitroglycerin tablets should be administered sublingually. One tablet can be given every 5 minutes up to 3 doses. Nitroglycerin may also be in spray form, in which case the dose is 1 or 2 sprays, every 5 minutes up to 3 doses. Nitroglycerin may cause hypotension, pounding in the head, tingling in the mouth, and tachycardia. When symptoms dissipate, treatment may resume if the patient is feeling well enough. If symptoms do not alleviate or are more severe than usual, further steps need to be taken.